Surgeons of Reddit, what was your oh crap moment? Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus, and suddenly, whoosh, baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which has the texture of a slip and slide, and almost rockets straight off the table. The baby's foot was caught by the reg, who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to the gloves plus vernix. Thankfully, the midwife was ready with the towel and caught the baby to wrap her up. Mum and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Story 2. I was doing a corneal transplant when I had the oh crap moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off, but before I could get a new one, there's literally nothing on the front of the eye except tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing everything up. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say, oh, that's not good. Those really in the know will say, oh crap. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used nylon sutures which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. Or, a hot take, don't lie to a medical doctor about most anything, especially if it has to do with a surgery you have coming up. They ask you questions to keep you safe, you fool. Story 3. Happened at my hospital. A mentally ill young woman who was pregnant at the time was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. The ER realized her baby had died inside of her and basically was rotting, all due to the smell. She was taken to the OR to remove the baby, and apparently all the nurses and surgeons were vomiting because once they opened her up, the smell was overpowering and it was traumatizing to see a rotting baby. Story 4. Not a surgeon, but I thought I'd share this though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthesiologist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to more of a strawberry blonde now. The anesthesiologist laughs and says, okay, I gotcha. We'll give you the redhead dosage, and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out, not a joke. Redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage and he still woke up. Happened a couple of years later. They gave him ket and some other crap to knock him out to get wisdom teeth out. When he told the dentist about the colonoscopy thing, he still woke up at the end of that one too. Story 5. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go, oh crap, was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of the youngest patients I'd seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to do butt stuff with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. Well, because a pain in the butt joke is a little low-hanging, I'll just say, that sucks, man. And I promise there's no pun intended there. Like, that really is just unfortunate. That is a genuine lifestyle change that has to be considered for them. Story 6. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night, intubated, breathing tube in, sedated, Foley catheter, tube in pee hole, and all. Long story short, he was extubated, breathing tube out, that same shift, and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now, the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore. And this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's orders to insert one, we could remove one at our discretion. unless a doctor specifically puts in orders not to. This patient had no such doctor's orders, so I went to remove it. They're held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I deflated the balloon, removing 10 milliliters of saline, and I pulled it out. As soon as the catheter left, blood started pouring out in a heavy stream. Turns out the nurse who had placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's dong shut to put pressure on it while my coworker paged the resident, who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's dong in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total, I held this man's dong and tried to make polite conversation until the urologist arrived. Yeah, no wonder that hurts so much. I am sorry to everyone who had to listen to that. Story 7. I'm not a surgeon, but when I was in med school, there was an oh crap moment for everyone, including the surgeons, anesthetists, nurses, and students. They were prepping a patient for surgery and put him under. The nurse said, "Okay, he's out," before they were about to start slicing him open. The patient had just enough strength to move his head from side to side and say, "No, I'm not out yet." Everyone laughed it off, but if the patient didn't do that, it could have ended badly. Story 8. Not a surgeon, but was working in an obstetric theatre in UK mid-heatwave last year. This is important, as maternity wards are kept quite warm, as newborn babies aren't good at regulating their temperatures. Combine this with a heatwave and the fact that in Britain we're not exactly used to high temperatures, and we have the perfect storm. Mid-emergency cesarean, the scrub nurse assisting the op feels faint. This is unusual, as the scrub nurse worked in these theaters full-time, so this was her bread and butter, so I can only conclude it was the heat. She has to step out, so the SHO takes her place assisting the OBS registrar with the section. This SHO looked extremely junior, as in first section ever, and they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab at the back of their theater gown to stop them from face-planting into the open uterus, and then sort of gently tug backwards to let them fall into me when someone else had taken over assisting. This SHO was not exactly small. Thank God the baby was already out. Story 9. I was the patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. So he accidentally caused a nick, which caused a hemothorax. When I woke up, I couldn't breathe. They did an x-ray and had to do a chest tube. Eventually, I was so exhausted I asked to be vented, so he vented me. Apparently, he cried he felt so bad about it all. It wasn't him being malicious or negligent, just an accident. Story 10. 5th-year resident here. There are lots of bad oh crap moments throughout training, such as necrotizing soft tissue infections or take-backs for bad complications or deaths during cases. However, I'd like to share a recent positive oh crap moment. 15-centimeter kidney tumor with thrombus into the vena cava. Big incision, great exposure of the vasculature and the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein, and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days, margins were negative, and is still doing great. First time I felt, oh crap, I'm a surgeon. Story 11. Heard an oh crap moment as a patient on the operating table. A couple of years ago, I was in labor for 28 hours, pushing for 6, and my child started showing signs of distress. He had slightly elevated heart rate and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hands and says, "We're going to the OR now." At that time, I started feeling that zoomed out tunnel vision that I know for me is shock. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh crap, look at this." They saw blood in my catheter bag, and upon fully opening me up, found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried, and he was a completely normal, healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad, but I googled it after and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous, often fatal. I read from the time it happens, you have about 15 minutes before you bleed out and the baby is dead. When I went back for my post C-section follow-up, my midwife let me know, as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them a few days later after my birth, they all got together to discuss my case. I was so incredibly fortunate I chose to labor in a hospital, and that the doctors knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life, and our family will forever be grateful. Story 12. I work in the OR and have seen some pretty interesting things. First day on the job, the surgeon was doing a lap sleeve gastrectomy. During this procedure, a medical device is used to cut and staple the stomach simultaneously. However, in this case, the medical device failed. The stomach was cut open, but the staples never engaged, which left the patient with an enormous gash in the stomach. The surgeon ended up finishing this part by hand. I got called into a room to ensure the laparoscopic camera was working and able to record. This was a 6-hour cardiac procedure and was nearing the end, so I knew I was about to see something good. The surgeon pulls out some kind of growth from inside this guy's heart. This thing was the size of a chicken wing. It was growing through his valve, and I'm honestly amazed they were alive. Supposedly, the only symptoms were shortness of breath. Story 13. Every time I see a question like this, it takes me back to one of the greatest Reddit comments in history. Here it is. OR nurse here. I was taking call one night and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid drug users, so late night emergencies were common. Got to the hospital where a few more details awaited me. Pararectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the butthole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314-pound Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning. So after I confirmed her identity and what we were working on, I figured it was best to just get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot though. Chronic drug abusers who don't handle pain well, and who have used so many drugs that even increased levels of pain medication don't touch them, simply because of high tolerance levels. We got the lady off to sleep, put her in the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of, "Oh, Jesus, send me now." The surgeon steps up with a scalpel, sinks just the tip in, and at that exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. "Oh God, I just threw up in my mask." The other nurse was out. She tore her mask off and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't freaking breathe. My lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in. letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head, specifically him asking if this is real life. In all operating rooms everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like these, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the job and shower off. I sprinted to our central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty freaking box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil and not replaced a single drop of it. To this day, if I ever figure out who it was, I'll end them with my bare hands, but not before cramming their head up the colon of every last drug user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub which we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could on the inside of my mask, just to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could take a stand next to his machines long enough to make sure the woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this. But in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the front desk, where the other nurse sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy in blue surgical garb standing nearly ankle-deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's butt, and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out. He and I didn't say a word for the next 10 minutes. As he scraped the inside of the abscess until all the dead tissue was out, the front of his gown a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could. I helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I have read this comment before on my own time, and let me tell you, it made it 0% better to read again. It is absolutely a legendary Reddit comment, don't get me wrong, but only because what it describes is so truly horrific. Honestly, I don't even know if my narration did it justice. Story 14. When I was younger, I had a rather complex external fixator, cage, applied to my leg. It had 3 rings, 2 large 360-degree rings around my leg, one in the upper middle of the shin, one on the lower, which had humongous rods to keep the cage fixed to my leg, and a third one, which was a horseshoe-type ring around my ankle, which threaded all sorts of pins through my ankle. The point of this external fixator was to relocate and fix the positioning of my ankle, so it wouldn't be screwed, basically. I have/had a birth defect called talipes, clubfoot, equines. A lot of bone got removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before with the numbers on them, almost like those sizing things on cheap coat hangers, were all colored and numbered, set for my dad to do every morning and night. He was looking at the pins and the numbers. He looked, glanced away, and looked back with a stressed face. After a few seconds and a slight hand-on-head gesture, he whispered, "Crap." In his mind, he had organized the pins in an incorrect way. He was stressed beyond his mind for a few minutes. He was worried he screwed everything up. Luckily, he hadn't. He just needed to move a number or two. 1 year later, 8 months after the frame was taken off, which was on for 6 months, I ended up having my leg amputated. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The amputation got me running. Bear in mind, the amputation was my call. I was 12 when it was done. Best decision I ever made. Story 15. During my 3rd year of medical school, I was stitching up the wound after breast cancer surgery, and the anesthesiology nurse woke the patient up too early as I was making my last stitch, and I felt the patient moving her arm and trying to sit up. Patient was still covered in surgery draping and cables and still intubated. Luckily, most people do not remember much from the first moments after waking up, but I got quite nervous from the patient starting to move. Story 16. When I was in pharmacy school, I was doing my internal medicine rotation in my final year. My preceptor and I were doing med reviews in the ICU, and one of the pulmonary docs was basically like, "Hey, you want to see something cool?" They were trying to extract a foreign object from a guy's lungs in one of the rooms. So we go in and watch for a bit. About 6 people in the room. Tube down the guy's throat, little grippers at the end. 2 doctors watching a monitor and trying to control the grabbers and get it like a claw game. I watched for a bit, then after a while I lost interest, and went back out to what I was doing. A few minutes later I hear, "Got it!" cheers from the room. "Oh, it's a tooth." Dude aspirated his own molar. Doctor walks out with his trophy in a jar, and it's a completely intact tooth, root and all. A tooth in the lungs? But also, with this story and oh crap, I honestly thought the doctor was just gonna drop the tooth back in. Like, glad he didn't, but that's where I thought it was going. Story 17. Just an RN here. I was working in the ER and had a patient brought in by her husband. Apparently the woman had a fall a week prior and injured her face but refused medical care. Her husband finally forced her to come in. As soon as I see the wound on her face from across the room, I think, that doesn't look like any wound I've seen. I approached her and realized maggots had infested the wound and were eating the rotting skin. A really simple and quick fix, but I can't imagine her living conditions. Story 18. Sorry in advance for this being so long. Not a surgeon, but my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone, and that her kidney was infected and had lots of gross pus shutting it down. After draining the fluids through tubes over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent put in and the tubes, no problem. Next was the kidney. Here comes the oh crap moment. As they get ready to remove the kidney, there were complications. The kidney's infection had spread to a portion of her lung and a major artery, making them fragile as toilet paper. As the surgeon removed the kidney, a hole was torn in the lung, and even worse, the artery was severed. At that point, it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital and have a heart surgeon fix the severed artery in a more permanent fashion. Anyway, the heart doctor saw the grave situation and said she has a 1% chance for her to make it. But he did an excellent job, and my mom is still alive, getting stronger each day. The moral of the story is this. If you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your life, and also save some doctors from an oh crap moment like this. Story 19. Not a surgeon, but when I was in nursing school, I was observing a tonsillectomy when the power went out. Everything switched over to the backup generators except for the suction, which is incredibly important for any surgery, but particularly in the throat. Aspiration risk. They ended up having to connect a giant syringe to a length of suction tubing to suction manually while someone went to the other side of the building to find portable suction. Luckily, ours was the only theater that had started operating that morning. Story 20. Former med student here. Rotating through general surgery was mainly an enjoyable time. I remember one young patient, 22 years old, was revisiting the ER where he'd been seen 6 weeks prior for sustaining some abrasions and bruises after falling hard off a skateboard. He was all scraped up everywhere, but healed up okay. But now he's in the ER again, feeling awfully sick, vomiting, and with a fever. As the third-year med student, I was dispatched to the bedside and hung up the CT films on the light box. Too much finger-pointing and grunting among the surgeons. I had no idea how to read a CT at the time. Wasn't even really sure what part of the body had been scanned. So when the surgical resident barked, "Prep him for surgery," I was nonplussed. Decided to disguise my ignorance and just go for it, as was the approved way for students at this busy public hospital way back when. We got him gassed and prepped and I scrubbed in. Surgeon said, "Open," and I raised the number 15 blade. He'd been prepped for a midline laparotomy, but I guess I exposed my ignorance when I spoke up to confirm same. This was decades before timeouts, before wrong site became a never event because everyone laughed. I opened and it went uneventfully, reflected the omentum with its lovely arcades and exposed the viscera. "You remember how to perform the Kocher maneuver?" the attending barked. Yes, sir." "Well, do it." I slid my gloved hand up into the splenic flexure, getting well ready to grab the entire sack of intestines and move it up and over, the opening salvo of the Kocher maneuver, but met unexpected resistance. I peered up, seeing in my confusion that everyone was edging away from the table. "What's the trouble, young man? Get your hand up there and complete the maneuver. Push harder." A spongy sort of barrier gave way, and with a sickening stench, immediately recognizable as the locker room aroma of Staphylococcus aureus, a gushing cascade of 2 liters of gray, brown, bloody pus roared out of the incision, soaking my gown, scrub pants, and shoes before splattering on the OR floor and walls. The splenic abscess, doubtless caused by the transient bacteremia from his skateboard accident, had been lysed, ruptured, evacuated, and mostly cured. The attending finished up with the splenectomy, and after some abdominal lavage, the patient was good as new. I had to throw out my shoes. So, judging by the fact that everyone backed up, I would say that OP was the only one who didn't know what was going to happen here. A bit of a cruel move for this poor doctor in training, but I'm sure everyone there thought it was hilarious, except for OP, probably. Also, a lot of medical words in that one. I did my best. Story 21. As the patient. I hope if the oral surgeon is on Reddit, they posted this story. Wisdom teeth removal, all 4 impacted. Gotta break out the heavy hardware. I'm knocked out, don't even know the dentist entered the room. I wake up, but not able to move, just eyes open, awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My jaw is just coming undone on every hit. My eyes are wide open, jaw even wider with some evil metal contraption. I'm staring at the assistant, begging for her to see me, and after about a dozen hammers to my jaw, she glances over and drops the suction, jumps up, and shrieks. The dentist stops to look at her and then looks at me, and I see him say, "Ooh, crap." Next thing I know, I'm waking up post-surgery. Stuff that nightmares are made of. Story 22. Not mine, but my father's. He told me this back when I was 10, so I'm sorry if it doesn't fully make sense. Anyway, he had a 21-year-old patient that needed to have a penectomy. He had cancer of the dong. There were 2 oh crap moments for this. The first is a common thing. He wasn't fully asleep. The second, however, is funny and humiliating. They're about to start the surgery, and suddenly one of the nurses there threw up and left. A test later, and boom, she got knocked up. Halfway through the surgery, the other nurse leaves for call about her father. So my dad's just standing there, a half-gone dong in his hand. He calls for help, and is standing there with a guy's dong in his hand for about 30 minutes. Story 23. I was a 4th-year resident and I was on call that day. Around 5 p.m. I went to do rounds, and as I got to the first room, I came in to find the first-year resident on top of the very recently neck-operated patient. That morning, he had a tumor removed from his parapharyngeal space. The resident was kneeling next to the guy's head with his hands and clothes completely covered in blood. There was blood on the roof, on the sheets, on the bed, dripping onto the floor, you name it. I was instantly petrified. I went, oh my god, I have never repaired someone's carotid artery. I am completely unqualified to help this guy. Someone, please help us. I was the senior resident, so I was the only one on call at the time, and besides, none could get there in time to help this guy. He was bleeding out, so it was up to me alone to help him. So I took the guy to the OR as fast as I could and I opened him up. All of the time praying and telling myself, it's okay, I can do this. I can do this. I was crapping my pants while everyone was looking at me to fix him. I open him up and I see the freaking facial artery loose, spraying blood all over, so I clamped it, put a knot around it, and that was it. We closed him up, bandaged and transfused the poor guy, and I went to collapse on a stool. Story 24. Not a surgeon, but the patient. I was around 13, 14 and undergoing gallbladder removal. Almost unheard of for someone my age to have gallstones, bad enough to need a removal. But anyway, I was extremely underweight and sickly. The anesthesiologist gave me an adult dose of anesthesia and knocked me out for about 8 hours, when it took the surgeon about 40 minutes to complete my surgery. So there was a lot of panic that day because no one could wake me up. And I was mad when I woke up because I couldn't feel my left arm with the IV in, and I really needed to pee. Tried to get up to go to the toilet and ended up on the floor instead. They also got me a pee pot that I refused to use. Story 25. Not a doctor, but my grandfather was scheduled to have double knee replacement surgery when he was in his 70s. They go through a bunch of health screenings to make sure your body can take the stress of the surgery, and during one of those screenings, the cardio doc found an aneurysm in his aorta, running basically the length of his torso. The doctors were shocked he was still alive with that in his chest. He ended up having to have stent surgery in his aorta first, and then a few months later was cleared for his knee replacements. Story 16. Not a surgeon, but when I was a nursing student, I was on theater prac. We had a guy in who needed humerus and elbow repair. I was pretty useless in everything but emotional support, as I wasn't qualified, so was chatting to him before he went under. He admitted to having an unhealthy drug habit. I informed the surgeon, who shrugged it off. Apparently, I should have told the anesthetist, because this dude woke up mid-surgery and was trying to reach for his open arm that the surgeon was working on. Super oh crap moment as we tried to scramble to contain this guy's arm and stop it from touching anything sterile. Story 27. An oh crap moment happened to me when I was a toddler, but I barely remember it. They were operating on my lungs and forgot to give me enough general anesthetic, so I woke up 5 hours too early. Luckily, they were only doing minor slits into my stomach. They noticed the problem straight away and gassed me back to sleep. They couldn't inject me like they previously did because it was the middle of the procedure. Story 28. Not a surgeon, but a biomedical scientist. My office mate had his MD and was working on his PhD. He apparently did an appendectomy and cut into a person's abdomen only to find no appendix. So they started freaking out. The support nurses in the room started snickering at him because they knew right away what it was. Occasionally, they see someone with a rare genetic disorder in which all their left-right asymmetries are reversed. The appendix was on the other side. Doesn't seem so funny to me because the patient would have come in saying where the pain was. Story 29. I was the patient. It was a kidney biopsy. I was drugged up and out of it, but still awake, laying on my stomach as my kidney doctor worked behind me. He warned me, "You're going to hear a click and it will feel like Mike Tyson punched you in the back." Okay. I hear click, feel the punch, and then hear, "Oh crap, get so-and-so on the phone right now." A nurse came up near my face to calm me and maybe keep an eye on me. I don't really remember everything. Apparently he had nicked a blood vessel and I was bleeding internally at an alarming rate. I got to spend the night in the hospital and peed what seemed like pure blood for about 24 hours. Never try to fit your kidney biopsy in on a Friday before the doctor leaves for vacation. OP, I don't think this had anything to do with when you had your surgery. I think this doctor just made an oopsie. To put it lightly, I guess. Also, if any doctor warned me I'm gonna feel a punch like Mike Tyson just hit me, I think that would make me much more nervous about things. I don't know what I'd prefer to be told though, because being told this won't hurt a bit and then feeling that would probably be worse. Patient was taken to surgery for exploratory, and upon opening the abdomen, I was greeted with thousands of clear, fluid-filled cystic structures, roughly the size of marbles attached to every organ in the abdomen. At that moment, I realized that this patient had metastatic ovarian adenocarcinoma, and it was physically impossible to resect all of the metastatic lesions since that would be total evisceration of the abdomen. Patient was euthanized on the table at the request of her mother. Oh, at this point, I will point out the patient was a chicken. Oh my, OP, I hate you. That was really good, but I hate you. Story 31. Gastroenterologist here. Was removing a large polyp during a colonoscopy. I put the snare around the polyp, kind of like a cowboy throwing a lasso, and it took an unusually long time to sever the base of the polyp until, all of a sudden, blood started squirting from where the polyp was removed. The screen quickly turned red with blood. I couldn't see crap. The patient's blood pressure started to drop. The patient, who was a dark-skinned Middle Eastern man, turned pale white on the stretcher in front of me. That's when I felt like I was going to faint and empty my own bowels. The only thing I could think of was, oh, crap. Story 32. Not a surgery, but I did get a surgery on the injury. I dislocated my shoulder, but it was an inferior dislocation, so the normal pull it back into place is the wrong way to pop it back in. It dislocated once before, like 6 months prior. The nurse kept insisting that she knew how to put it back into place. She proceeded to pull on it for 15 minutes, all the while I'm screaming in pain. I started vomiting and almost fell off the gurney, profusely vomiting, and demanded a doctor. The doctor popped it in, no problem. Taught me how to do it myself. Shot me with God knows how much morphine, and has me sign papers that I don't realize release them of the liability of screwing up my arm even more. My shoulder was so loose I dislocated it reaching for my wallet in my back pocket. I had reconstructive surgery about 3 years after, and now have little less than 90% mobility in my arm, as well as cramps and pain if I sleep on it wrong, or reach too far or move it quickly. This all happened when I was 17. Story 33. My dad's not on Reddit, but he's told some stories. One of my dad's colleagues was doing a hip replacement way back in the day. We're talking 60s or 70s here. Hip replacements aren't fun. They pretty much have to butterfly you like a boneless roast to get the top of the thigh bone clear of the ball and socket joint of the hip. They then saw off the ball end and attached the new stainless steel one, which is on a long stem they insert down the middle of the bone to keep it in place. So he's got to that stage, tapping the stem down the femur when it jams halfway. Won't go down any further. Won't come out again. Can't saw it off. Bone saws won't touch hardened steel. Can't close up the patient and come back to it. There's a foot-long spear stuck out the top end of his leg. And the anesthetist is saying they can't keep him under much longer. Oh, crap. So, OP, what happened? Why did you stop the story there? I swear that's where the comment ends. Why would you do this? Story 34. I was the patient and I'm pretty sure it was an oh crap moment for my OBGYN. I was at the end of my labor and my daughter was stuck. I had had 2 epidurals, both of which wore off. My OB used forceps to try and get her out. I don't think she knew my epidural was as ineffective as it was. Otherwise, I don't think she would have shoved the forceps in like she did. I obviously felt the forceps and started thrashing in pain. The doc got scared and tried to take them out, but they got stuck. Had to wait for the next contraction to push them out. Then blood went everywhere. She was on the phone with her lawyer while wheeling me in for my emergency C-section. I assume that means she had an oh crap moment. Story 35. I work in cardiovascular and I can think of a couple. In my 8-year career, I've had 3 patients start moving their arms in the middle of open heart surgery. One of them even tried to sit up. The surgeon was literally pushing the patient's shoulders down and yelling to anesthesia to give the patient something. Another time, a simple pericardial window. For different reasons, sometimes the patients can have extra fluid buildup in the pericardial sac that surrounds the heart. The surgeon made a small hole and stuck the sucker in to suction the fluid out and make room for the heart. He stuck the sucker in too far and stuck it through the ventricle. Blood shot out of the small hole just below the sternum. He had to quickly open up the patient more under the rib so he could stick his hand in to plug the hole with his finger. We had to call another surgeon in to help quick crash onto the heart-lung machine. Story 36. When I was a surgery intern, I was pulled from doing scut work to help out in a crap show of a case. One of our professor emeritus in surgery was doing a simple liver biopsy on a patient, and nicked her hepatic artery. The biopsy was for a recurrent tumor, and the patient has been on chemoradiation. What all that basically means is the patient has a hole in a major artery and her tissue has the consistency of toilet paper. Every time they tried suturing the hole, the tissue just breaks apart, leaving a bigger, more leaky hole. Pretty much all hands were on deck. The chief residents were scrubbed in, the seniors were literally squeezing blood bags into the patient's veins, and us interns were runners, going back and forth from OR to blood bank to transport blood and plasma. We ended up transfusing over 40 units, 12 liters of blood, so the patient lost over 2 times her total blood volume during the surgery. A vascular surgeon eventually swooped in and did a rather slick patchwork that fixed the problem. Even better, the patient was like a daughter to the surgeon. He literally saved this patient's life several times already, and they got really close over the years. She even named one of her kids after him. The poor guy broke down a few times during the surgery and was convinced that he just ended his daughter. The chief residents had to take over a few times when he was mentally just not there. That was his last surgery. He retired the next day. Hell of a way to end a surgical career. With the backstory OP gave, this is out of like a medical drama season finale. Like the actual medical stuff, I don't fully grasp because, well, I'm not an MD, nor do I know much about medicine at all, let alone surgery. But I do know drama, and the story of the patient being like a daughter to the surgeon and it being his last day, that is drama. Story 37. Not a surgeon, but the patient. In 91, I had a dislocated shoulder. I had to have rotator cuff surgery. My orthopedic doc was giving me a shot of cortisone in my bursa. He kept missing it. It was painful, especially when I could feel the needle scrape my scapula. At that moment, the doc literally said, "Oh, crap." The nurse who was holding me steady in front of me got huge eyes. I just laughed and said, Now, doc. Language. I was weirdly calm for a 20-year-old. Story 38. Graphic injury description. Nurse here. My oh crap moment happened when we admitted a patient to the medical unit. Initially, the smell was horrendous. After removing his clothes, what I saw was worse than the smell. He had a very, very advanced bed sore that was on his butt. It had gone so far that X-ray showed his sacrum and the vertebrae above it were completely gone, as were his posterior iliac crests. What was left was diseased hanging loops of bowel, open ureters dripping urine into the mess, and lots of necrotic flesh. That was all laced together with greenish-black mucus, and at the very center, a bright red butthole oozing poop. I couldn't believe this guy was alive. I can still smell it 36 years later. I have nightmares about that butthole, and as I was a newbie on the unit, the charge nurse assigned him to me for the next 10 days. On day 11, he died. I still can't understand how his wife could sleep with him and not see or smell that. Story 39. Not a surgeon, but had some dental work done in my teens. I had 2 impacted teeth. One was being taken out by some elaborate gear, and the surgeon who had filled me full of drugs thought, well, the tooth is sticking out. I can just pull it. He tried one tug and almost fell forward out of the chair. The second pull, he had a nurse hold my shoulders. The third, he put his foot on the chair, used both hands, while the nurse held me from behind around the waist, and he yanked. And like in cartoons when a bullet bounces around the room and nobody can see it, yeah, that was my tooth. I was numb and didn't feel a thing except a warm sensation all over my chin. I learned then I was a bleeder. Story 40. Not a surgeon, but I have caused 2 surgeons to experience those moments. The first was when I went in for a sinus surgery / septoplasty. They gave me anesthesia, wheeled me into the operating room, transferred me to the table, and started to prep me. I hadn't had surgery since I was 5, so I had no idea what was normal. But then they started to drape me, and the surgeon walked up fully scrubbed. So I decided to speak and ask when I was supposed to fall asleep. Cue the panic from the nurses and techs. The doctor just laughed and called the anesthesiologist into the room to give me more drugs. I freaked them all out again when I woke up projectile vomiting while they were still cleaning me up. Before they had even transferred me off of the operating table. No, I hadn't eaten. It was all bile. The second time was last year when I had my port installed. I was supposed to be out thanks to twilight anesthesia, but it just didn't work. They wheeled me into the OR, and we were all waiting for it to just kick in. But I wasn't even getting drowsy, so they gave me more. Still, nothing. At this point, we'd been waiting for some time for me to at least get drowsy, but nothing was happening. So the surgeon had the nurse anesthetist call the anesthesiologist to get permission to give me even more drugs, including a stronger one that they don't normally use for twilight with these procedures. The anesthesiologist didn't really understand the fact I wasn't asleep yet because she said no, because they would have to get the patient's consent. So they put her on speaker in the operating room so that I could tell her I'd consented. She was quite taken aback, but gave me permission to get the drugs. I got all dosed up and we waited, but absolutely nothing happened. Finally, I just told the surgeon to get started. They use local anesthetic in addition to twilight with these procedures at local hospitals, but I metabolize local so quickly that it lasts for a few minutes at most. Yes, dental work is about as fun as you would imagine. So they got me prepped, numbed me up, and cut into me. I felt everything except for the very first incision. The surgeon and I chatted during the entire procedure to help keep my mind off the pain and discomfort. He said it was the weirdest, most terrifying port placement he has ever done, and he has done several thousand of them. Never with a patient awake and providing active feedback, though. Thankfully, these incidents taught me a lot about how I process and react to different forms of anesthesia. So now when I have surgeries or small procedures, I take in a paper that lists the different anesthesia medications that I've had weird or bad experiences with, so my surgeons are prepared. Story 41. There's been a few. For something I was doing personally, a kid fell on a broken coffee mug and had a tiny cut just below the sternum. I was to clean it up and close it up with some stitches, but when I was exploring it, I found damage inside was much more extensive. The heart was visible, beating away, and there was also a hole in the diaphragm and 2 cuts to the bowel. The oh crap stuff I've seen was stuff during transplants. There are these things called life ports that are used for kidneys. They allow fluid to circulate during transport from the donor to the recipient. One surgeon I was working with had dropped a kidney inside the life port on the ground. It cracked and skid along the ground. The kidney was okay though. Another surgeon just couldn't get it to open, and was getting frustrated and asked for a mallet. He was going to bash it. Story 42. Orthopedic surgeon here. Mostly do joint replacements. Several things. Started operating independent in my first job about 2 years ago. Was obviously nervous when I first started. Took me about 3 months to get comfortable being able to do this every day without stressing over every detail. One case, I just got this epiphany at the end that I just did a hip replacement on this patient in 45 minutes through a 5-inch incision. I've got a pretty cool job most days. Not an oh crap moment, but I felt pretty lucky. Doing open cardiac compression, think CPR on the heart from inside the chest, on a patient who was coding and had an ER thoracotomy. Split the chest wide open to access the heart from the inside. As an intern while wheeling the patient on a gurney up to the OR. Having a unit of blood run down my leg while doing CPR on a patient in the trauma bay. Connector between the blood bag and the patient's IV came loose and no one noticed until it had basically emptied all down my leg. Mostly just felt cold, but I had to walk through the main lobby of the hospital covered in blood past patients and families to get to my call room. Threw away my underwear and socks. Did the rest of the 24-hour shift commando. Having the CEO of the hospital get fired because he scrubbed into a case. He's an admin, not a medical person, and he made an incision on a cardiac case, and doing a total knee replacement in fellowship and letting the tourniquet down at the end. Knee fills up with blood in about 2 seconds. Long story short, my mentor had injured the popliteal artery and holy crap, that's a lot of blood. Story 43. Not actually during surgery, but I did a venous extraction, pulled the baby out with a vacuum cup, and even though there weren't risk factors for shoulder dystocia, the baby was stuck. Really stuck. None of the standard maneuvers helped at all, so I did what you do next and grabbed the baby's hand and tried to pull one arm out, which usually helps. But this baby had its elbow stuck somewhere. So I'm there hand deep in a woman, seconds ticking away. The baby will be dead in a matter of minutes, and we have already been trying to get it out for 2 or 3, and there are not many options left. So I pulled the hand hard. There was a snap and I pulled the arm out, rotated the baby 180 degrees, and pulled them out by underarms. The baby had a broken humerus but no brain injury, so in the end it went well. The fracture heals in a matter of weeks and should leave no permanent issues. So anyway, that was a nice build-up for the next patient of the night. My senior consultant went to do a manual placenta removal as I was stitching the shoulder dystocia patient. He called me to the OR, and I thought they wanted to know how everything went. He was running to the birth, but we got the baby out before he got there. But no, he had managed to remove half of the placenta, which was a surprise accreta. It had grown into the uterine wall, and his hand was cramping. That was when we started to think that we may have to remove the patient's uterus. That would likely mean 10 liters of bleeding, and the unit where we were didn't usually do gynecological surgery other than cesareans. In an effort to avoid having to remove the uterus, I went to tear the rest of the placenta off and actually managed rather well. So we put a balloon in the uterus to stop the bleeding, and were able to send the patient off to a larger center, where they actually ended up being able to not remove the uterus. It truly is just astonishing how humans as a species have made it this far. The way we birth is so just awful. And yet, here we are. Story 44. I'm just an RN. I do home health. I was admitting a patient yesterday and his referral basically said this is a VIP. Surgeon wants us to be very accommodating. Now, this is weird. Not usually the kind of things I get on a referral. So I get there and meet the guy who is incredibly nice. He just had a knee replacement, but he's otherwise healthy and functioning pretty well on his own. But midway through the admission, he gets a look on his face and asks, "Is it normal to hear things during your surgery?" During a knee replacement? No, sir, it isn't. He follows with, "When I woke up the first time, I could hear banging and some machinery. The doctor stopped and looked at me. He asked if I was awake, and I told him I was. The doctor asked me how I was doing and if I could count backwards for him. The next time I woke up, I was in recovery." Oh. So yeah, this patient's anesthesia was too light during an ortho surgery. Those are rough surgeries, and he was awake enough to answer questions and count. This is why he's the VIP. It's honestly not the surgeon's fault, but damn, that's a bad day at work. Story 45. In the mid-80s, my dad's coworker had liposuction on the back of her thighs. For the procedure, she was laid on her stomach and was placed under general anesthesia, or at least, she was supposed to be. She woke up and could feel the doc doing the liposuction, but was paralyzed from the anesthesia still, so she couldn't move or cry out. It was incredibly painful and incredibly traumatic. I wish I could remember what happened with her after, but my preteen brain was scarred enough at her having been a prisoner in her own body during surgery. Story 46. I'm not a doctor, but I have a family member that was one. During his residency, a gentleman came in with an infection he developed after having his gums scraped during a dental cleaning. The infection had gotten into his sinus cavity, and my relative told his attending that the gentleman was going to die. They had an infectious disease specialist from Harvard at the hospital at the time, and he called my relative an idiot. The attending corrected the guy from Harvard, saying that no, the guy was likely going to die. He had seen 10 such infections previously, and each time the person passed. Apparently, there's a part of your face some physicians call the triangle of death. The gums of your top teeth form the base, with the sinus cavities forming the arms. Okay, the story's not over yet, but arms of a triangle? Surely you just mean the other sides of it, right? Anyway, moving on. Sorry for cutting in the middle. I just got mentally flashbanged. Anyway, over the next 2 days, the infection spread to the guy's left eye. Mr. Harvard said they should take the eye and hopefully that would be enough to save him. My relative said it's not going to make much of a difference, and the guy should start working out his final affairs. Obviously not wanting to give up, the gentleman consented to having his eye removed. It didn't make a difference, and within 3 days of having his eye removed, the gentleman was dead. Infection went from the sinus and ocular cavities and through the blood-brain barrier. Story 47. Not a surgeon, was just an LVN at the time, working in a small-town LTAC, what a med-surg unit used to be before insurance got weird. People stayed for between a week and 6 months or more to heal from whatever they had, lots of vents and trachs. I get a call from the local ICU that one of my patients was returning after being shipped out to the main hospital for a GI bleed repair. The RN on the phone is giving me a report and offhandedly reports, "He was throwing up a little this morning, but I've been checking his PEG, feeding tube, and there are no residuals, so I don't know where it's coming from. Must be reflux." So after an hour or so, EMS rolls the guy in, and he has vomited all over himself during the ambulance ride. We set up suction to get it out of his trach, and I notice, this guy has been with us for a while before his surgery, that his stomach is super distended. Like Prego man distended. He was a big man, but not that big. I go to check residuals because I never trust report, especially with evidence to the contrary right in front of my eyes. I attach a 60 milliliter syringe to the PEG and pull back, and get a syringe full of air. Now, if you check residuals and the stomach is actually empty, you may get a little air before the tube collapses on itself and stops pulling back. No, syringe full of air. Empty the syringe again and pull back. Another full syringe of air. After this, I look at the EMTs and the attending, who is now in the room, and remove the end of the syringe. There's an audible hissing noise for a good 5 seconds as air escapes, before black, digested blood starts rapidly filling the tube. MD tells to hook the PEG to suction, which over the course of 5 minutes fills with 500 milliliters of blackish, reddish, green contents and more air, indicating that there's not only still a bleed, but possibly a perforation as well. The attending called the intensivist on his cell phone from the room. The intensivist was like, "No way, my nurse wouldn't be that stupid." So the doctor sent him a picture of the canister. The intensivist sheepishly calls back and reaccepts the patient back to the ICU. He underwent a revision and was back to us a week later feeling much better. I still have nightmares of that syringe filling with blood. Story 48. Not a surgeon, but a patient. When I was like 12, I had this growing lump right behind my ear, which was super painful, to the point where it became difficult to sleep. Obviously freaked out, my mom took me to a doctor and they were just as stumped, saying it might be a huge pimple or something similar. She called the on-call surgeon just in case. He took one look and said something is definitely in there. After some local anesthesia and a lot of digging, turns out one of my earrings, tiny butterfly studs, had burrowed into my ear during my sleep and made its way deep into my flesh. My mom suddenly recalled my missing earring, thinking it had fallen off in school or something. Kinda freaky. Story 49. A surgical first assist here. A patient came by the ambulance as she was too obese to move, complaining from bad taste in her mouth. Me and the surgery resident at the ER went to check her, and she started giving us info. She then told us she would sometimes feel pain in her belly, so we uncovered her to see what's going on, and oh my god, her whole abdomen, from the pubic bone to the diaphragm, was all gangrenous. The surgeon immediately took her to the OR, where we started debridement. The smell was horrible. The med student fainted there. We kept removing dead tissue and bowel, even the goddamn spleen. It was so radical that when the time came to close abdominal wall muscles, there were no muscles left to stitch together, and we had no vacuum at the time to use. So we had IV solution in sterile packaging, so we opened a few like butterfly wings and stitched it to what is left of the muscle end sheath. The surgery is completed and the patient was sent to the ICU. A day later, I was rounding that patient and she was doing fine, and then started coughing uncontrollably. This caused her to tear the stitches, and all of the insides came spilling outside on the bed. It was horrifying and I fainted. When they woke me up, I knew that she had passed away, unfortunately. I was a student back then, but it still haunts me to this very day. Story 51. I'm not a surgeon, but my parents always told me the funny story of my C-section birth. Apparently I was trying to come out the wrong way or something and it wasn't working. They decided to go for a C-section. So everything was going fine and my dad had said that they used these hooks to keep the muscles from closing up the incision. Well, they started to extract me head first and apparently one of the hooks slipped loose and the muscles closed around my throat. So my head was sticking out of my mother's abdomen and my father said it looked like the scene in Alien with the chest baby. They quickly righted the situation, but my dad was a little grossed out for a while. Your dad was a little grossed out? How did your mom feel? I can't imagine how horrifying that must be. To be like, oh my god, I almost ended my baby's life by accident. Well, no, she didn't really do anything, but I don't know, that's how I think I would feel. Not that this is a scenario I would ever be in. Anyway, horrifying. Story 53. So this happened when my wife was giving birth. Natural wasn't happening. The baby was way too big and my wife wasn't dilating fast enough. They tried an artificial dilation, the balloon method, I can't remember the name, and it didn't work. So they ended up having to do a C-section. They do the spinal numbing and everything seems to be going okay. I'm super squeamish and tell them I might have to leave. My wife, though, is really curious, to the point where she's considering asking if they'll let her look over the curtain, until she says, "I can feel that," to the doctor cutting into her. At first, he doesn't understand, so he asks, "You can feel this?" And he cuts even more. My wife, having extreme control, says more sternly, "Yes, I can feel that." In what feels like an instant, they have me out of the room and the anesthesiologist putting her under. Those doctors definitely had an oh crap moment. I also had an oh crap moment, followed by hours of extreme anxiety because I saw neither my wife nor my baby for that time. In the end, everything went well, however. Story 54. Standard appendectomy. I was a resident at the time. Surgery was ready. The surgeon began, and then we realized that the patient didn't have an appendix. Turned out he had appendicitis a few months prior. So he went to the ER and they said he had appendicitis. And the treatment was an appendectomy. So this time when he had similar pain, he went to my hospital and said he had appendicitis, because that's what he thought stomach pain was, I guess. And in some strange breakdown in communications, someone approved the surgery. Never found out why his stomach hurt. Story 55. Not a surgeon, but EMT at large-scale events. Got an emergency call about someone coughing up a lot of blood after taking a nasty fall. Talking pints here. It was one of our interns doing the call, so you might suspect where this is going. But I didn't at the time. So that is when I had my oh crap moment, because that's a lot of blood. I was ready to dial the ambulance. I arrived at the patient, looked at the ground where she had puked a lot, and it was bright red. My first question is, so, what did you drink? She listed about every red drink on the list, plus a few Cokes when she started to feel unwell. TLDR, got a call about someone puking a lot of blood. Seemed no blood, just a weekly pay's worth of red booze. Story 56. Not a surgeon, but was present when it happened. My ex-wife and I were expecting our first together. We had a planned C-section, seeing her first kid had been a breech. I'm sitting next to her in the OR waiting for my first daughter to arrive. About 5 minutes in, I hear the doctor say, "Ooh, my, that's not right." As a first-time dad, I started to panic. Come to find out, the scar tissue from the previous C-section had stretched so thin, the doctor could see our daughter clear as day before he even opened the uterus. Found out it's described as a neonatal window. If we had chosen to go the natural way, there was a very good chance my ex's uterus could have ruptured. Next, 2 kiddos were high-risk pregnancies with explicit directions not to allow her to go into labor. Story 57. I'm an anesthesiologist. In my first year of residency, we had a young patient of 25 years posted for a relatively harmless liver abscess aspiration. I was in my 3rd month of residency and was responsible for loading the drugs to keep him under. After the patient was under, we had to turn him onto his side so that the surgeon could have better access. One of the technicians was asked to press a button on the remote control which controlled the OR table, so that the head and neck were on the same level as that of the abdomen. When he started to press the button on the remote control, the button got stuck and permanently pressed down. The neck immediately went into a 90-degree bend, and the patient immediately went into cardiac arrest. I vividly remember this case as it was my first oh crap moment. Immediately, all my attendings ran into the room and started to give him CPR and revived him after 3 cycles. Story 58. A few years ago, I was performing an esophagectomy. It's one of the riskier procedures that I've done, but it was necessary for this patient. We'll call him Stanley for the purpose of this post. Stanley had been diagnosed with stage 3 esophageal cancer that had progressed in such a way that this was his only treatment option. For the first 2 hours or so, it was what I would consider a routine procedure. My team and I had opted to remove the esophagus through the neck and through the abdomen. We finished with the neck portion and were preparing to proceed with the abdominal portion, when our patient suddenly awoke and yelled, "And shove it up your butt." Story 59. Not a surgeon, but a respiratory therapist. I've got a pretty bad oh crap moment that happened when I was still a student. So we had a guy who started coding a couple hours after getting a thoracentesis, removing fluid from around the lungs with a big needle. He's difficult to ventilate. I don't remember what exactly transpired, but next thing we know, there's blood everywhere. One of the residents was trying to put in a chest tube when he nicked an artery. Dude literally had his gloved finger plugging the hole. Whenever he removed his finger, blood was squirting out like a hose. Finally gets the chest tube in, and blood immediately pours into the drainage system and overflows it within a minute. They normally fill over the course of hours to days for reference. Pretty much the whole damn room was filled with blood, and shockingly, he didn't make it. Well, an unfortunate last story to end it on. I feel like the percentage of stories where people didn't make it was only like 5%, and we have to end on one? Oh, I did not plan this well. That's on me, guys. Anyway, all the stories for today. Lots of not a surgeon but in here, and hey, who can be surprised? It's Reddit. How many surgeons are actually going to have time to put stuff on Reddit? But hopefully you found the stories interesting nonetheless, because hey, I did. Anyway, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.